Welcome back. According to Financial Secretary Simon Wilson, there is no definitive date as to when government would comply with the Public Procurement Act requirement to disclose contract awards. In April, Mr. Wilson said the government would fulfill this obligation when the reporting capacity of its procurement system improved. He said information was being backfiled on the new Bonfire procurement portal. On Wednesday, he was asked for an update on the progress being made.
That's a work in progress. So we have made great strides. We have most agencies have their contracts reported. There are one or two ones which we think are critical to be included before we publish. So we wait for those agencies to upload their last of contracts awards. And once that's done, we'll be able to publish.
As for a new timeline, Mr. Wilson says he would like it to be done as soon as possible and that he is working with the agencies to make sure that they have all of the contracts completed. Asked about the delay in complying with the law, he says the government is committed to compliance.
The act came in effect July 1st. This is the 24th. All right, so I don't know what's too long.
Well,
It's something that we have put in the agenda. So, for example, there are many different aspects. So we've the attendance boards are all in place, all functioning at all ministries. The rules are being followed. All right, we're doing more public procurement than ever before. If you go on our portal, you'll see many opportunities that were never there. All right, so we're doing everything that we should be doing. It's always a work in progress. Yes, we can improve. The publication of contracts is an outstanding item that we're working on, but we are actively working.
The Public Procurement Act mandates government to disclose the names and address of winning contract bidders and the amount awarded within 60 days of them being awarded. Coalition of Independents leader Lincoln Bain not buying the statement released by the Department of Immigration that Minister Keith Bell was in Miami and not Switzerland when he spoke to a dying man who asked him to swear in his wife and children as Bahamian citizens. Mr. Bain says someone is not telling the truth.
The statement is even more disturbing than the actions of the minister. We also notice that the statement is not signed. No one wants to take credit for that statement. But there's some claims in that statement that are very erroneous. For example, the statement says that the persons were, the Chinese were here legally. When the actual report from the officer in charge of the scene says that they had at least 3 instances that they could identify where the persons were here illegally, and this is confirmed in their system. And so for the government to say something opposite to that, it is clear that someone is lying. I don't think that the officer in charge, the honorable officer, would be lying. And so this is very concerning to us. And 2 of those persons that they received information for were females.
The statement by the ministry also reveals that the Chinese nationals who were apprehended at the British Colonial Hilton and subsequently released following a call from Minister Bell were in the country legally, and their employers were in the process of applying for work permits. However, Mr. Bain says that statement is a complete contradiction to the statement released by Director of Immigration, Keturah Ferguson, who stated the department had no idea who the remaining 62 Chinese nationals were, nor how they entered the country. Mr. Bain says this raises concerns of possible human trafficking.
And so I have not seen any female Chinese construction workers on any site. And so the fact that there are females present make us concerned that this is really human trafficking, not a work permit issue. They made several claims that we can say that are disturbing, and we're going to have to take this to the next level. It is a statement that is full of lies and denials. They are referencing the leader of the opposition and asking him to give specific examples. The leader of the opposition didn't have the courage to actually state names, and of course, without him stating names, he didn't give specific examples. But we did that, and we're calling on them to do that, and we're going to present that to them in writing again with specific examples and names and information from their computer system to show that they are lying.
Mr. Bain says the Coalition of Independents intends to go before the courts for a judicial review. Cabinet has approved close to 150 security officers from the Family Islands following many concerns from nurses and doctors who say they are working in fear on those islands. President of the Bahamas Workers Union, Muriel Lightbourne, last week attended a press conference with over 7 unions pleading with government for safety measures after she says nurses and doctors were held hostage in a makeshift clinic on Eleuthera.
We had an incident on the 27th of May where the clinic in Palmetto Point was, I call it, held hostage. In terms, there was a home celebration, a homecoming celebration. There was a stabbing incident. The perpetrator came into the clinic at the victim, I guess, to finish what he had started. And during that, the nurse and the doctor was held hostage in the clinic. Now, along with one of the victims. Now, my take is this. When it came to me, I thought we was talking about a clinic. But we're actually talking about a house, a 3-bedroom, 2-bath house that the clinic is presently utilizing. A problem again with that is that that clinic, that house, was only to house our nurses, the clinic, for 3 days. It's been 4 years now.
Minister of Health and Wellness, Dr. Michael Darville, when asked for an update on the matter, says he is aware and very concerned. Some of the nurses are even traumatized.
I have spoken to my staff, and a year ago, I approached Cabinet to bring on board security officers throughout the Family Islands. This is important to us because most of our clinics are manned by nurses, and they're females. And sometimes at night, they have to go to the facility, and I don't think the situation is quite safe. The residents in the Family Island and here in New Providence will begin to see us bringing on additional securities. The reason why that's not happened yet is because we want to train them. A security who manned a warehouse is different than a security who will man our clinics. But I was concerned about it. The union was informed. My senior staff members went into the area, and we intend to fix that. And I have already gotten Cabinet approval to bring security officers on.
Dr. Darville also addressing concerns from Ms. Lightbourne that nurses are living and working out of a 3-bedroom, 2-bath house on Eleuthera for 4 years now and not a proper clinic. He says they are in the process of renovating all clinics across the country.
We are renovating them. I need to ensure that they're maintained, and I need to make sure that services are provided safely at all of our Family Island clinics and protect our nurses in those far-flung islands who need our support. We intend to do it, and we have already gotten Cabinet approval to hire the necessary security staff in order to accomplish it.
Dr. Darville apologized to staff for incidents like these and assures the doctors and nurses that he will not continue to allow this to happen without putting the necessary manpower in place. COVID cases are not surging in the country. This coming from the Minister of Health and Wellness, Dr. Michael Darville, following a memo circulating on social media seemingly from SuperValue owner Rupert Roberts, alleging that there are thousands of new COVID cases that the Ministry of Health is not reporting to the public. Dr. Darville says those claims are not true.
Yesterday, I released a press statement clearly refuting that and making it very clear to the Bahamian people that we've been noticing a decline in our PCR testing, and subsequently did a follow-up, and we're only seeing anywhere from 3 to 5 cases that are actually emergency. I was also informed, as of yesterday, there was really no one at any of the intensive care facilities at the Princess Margaret Hospital associated with COVID. But with that being said, Dr. Tedros clearly indicated that it's no longer an emergency public health issue. The Bahamas and the Bahamian people must understand that COVID-19 is still with us. It's everywhere. And it is our responsibility to execute the necessary protocols, hand washing, social distancing. All of these things are still in effect. We're not governing by rules anymore, and we ask Bahamian people everywhere to be responsible.
There have also been concern that the 50th independence celebration would have been a super spreader of the virus. Minister Darville disagrees.
if we look at what's going on around the world, everyone's doing their business as usual now. We are now moving on from the fear and anxiety associated with COVID, but I do advise the Bahamian people to practice the gains that we have, like social distance sanitizing. And if you have a cough or you have a flu, if you're going to cough in your elbow, or in the middle of your elbow, and if you have an upper respiratory tract infection, be responsible. Wear a mask, because you have family members, you have co-workers, and the possibility do exist that it could be influenza as well as it may be COVID. So let us be cautious and mindful of our surroundings and our brothers and sisters in the Commonwealth of the Bahamas.
Dr. Dowell encourages businesses to continue with sanitation practices.
For those businesses, we ask you, and I spoke about it in my budget presentation, keep the sanitizer in the facility so that we can practice some of the gains that we have accomplished in the fights of all upper respiratory tract infections. So while COVID is still with us, we have influenza, we have flu-like symptoms, and they're in the Commonwealth of the Bahamas. And so the social media clip, I don't know where it came from, but I could tell you what's happening in the country, and it is fictitious, the social media trend.
That was Minister of Health and Wellness, Dr. Michael Dowell. And that'll do it for your JCN Evening News. Once again, I'm Jarino Saunders. Thanks for joining us.
This segment of the news has been brought to you by Sun Oil Limited.